Welcome and good afternoon to everyone. My name is Dr. Mutsa, and I'm really excited to welcome you to today's webinar presentation that's titled Understanding the Long-Term Effects of Poor Sleep in Refugee and Newcomer Communities. So we are the Resource and Empowerment Technical Assistance Center for Behavioral Health, also known as RMTAC. And we're made possible by funding through the Substance Abuse and Mental Health Services Administration, which is SAMHSA. We're excited for you all to be joining us today. So on this slide, you'll see some of the areas that will be addressed during the presentation today. We're going to cover quite a lot of really great, interesting information, and we encourage you to note any questions that may come up. We will have a Q&A session at the end of the presentation, but feel free to drop your questions in the chat as we go. And we look forward to kind of making sure that this is interactive and that you all have an opportunity to have your questions answered. Okay, so now I'm going to hand it over to our clinical consultant and presenter of the day, who is Dr. Mohammed Z Ali, also known as Dr. Z.
Thank you, Dr. Mutsa. Appreciate it. Ladies and gentlemen, I am Dr. Z. I'm Mohammed Z. Ali. I'm a clinical consultant with RMTAC. I am a clinical psychiatrist. What we're going to do is start with our learning objectives. So what we're going to do today is we're going to describe some of the common sleep disturbances seen in newcomer communities. We're going to explain how the chronic poor sleep affects mental and physical health over time. We're going to talk about PTSD. We're going to talk about depression, anxiety, emotional dysregulation. We're also going to cover something that's a little different for us. We're also going to cover the metabolic or the medical side, specifically cardiovascular side of the long-term effects of poor sleep that can affect newcomer populations. And also we're going to apply a trauma-informed sleep intervention model to help with standard clinical sleep assessment. So let's talk about what actually sleep is a dynamic survival adaptation that, when chronically disrupted by trauma, becomes a core maintainer of PTSD pathology. Now, we can talk about how this is going to be the confluence of, say, rigorous science, actionable protocols, and also, that sleep is not necessarily vulnerability, but it's a finely tuned survival system. Listen, so the human body is actually designed to survive. The mainstay for the human body is for survival. So in acute threats, the body will suppress certain behaviors, certain experiences in order to promote survival. And unfortunately, a lot of times, restorative sleep tends to be one of those adaptations that the body tends to suppress in order to maintain survivability. So what happens in terms of poor sleep? Well, we have what's known as the hyperactivation of the locus coeruleus norepinephrine system. So the corticotropin releasing hormone pathways, reducing of the slow wave sleep systems, and REM sleep as well. So basically, you reduce those restorative sleep patterns in order to improve survival. What happens also is that you have the amygdala, which is the amygdala hijacking of the ventrolateral preoptic nucleus sleep switch, which is also utilized in the hippocampal involvement in contextual threat tagging. Basically, what all that boils down to is that you have the formation of poor sleep memories, and really you have a worsening of the sleep issues that cause PTSD and ultimately lead to poor sleep and fragmented sleep and broken sleep, which chronically cause maladaptive personality, persistent hyperarousal, prevents the offline processing needed for fear extinction and memory reconsolidation. Basically, what happens is that you have all these disruptions of circadian rhythm, and you have what's known as a problem with environmental allostasis, which causes a lot of physiological adaptation and cumulative wear on the body from the chronic stress of poor sleep. So what are the common disturbances? Stuff like insomnia, the trauma-related nightmares, nocturnal hyperarousal and panic, comorbidities, which include obstructive sleep apnea and periodic limb movement disorders, circadian misalignment, delayed phase as avoidance, and parasomnias. Polysomnography can show increased REM density with increased sleep fragmentation, and reduced slow wave sleep onset issues, and more arousals, otherwise known as fragmented sleep patterns. What happens is that these maintain PTSD and cause broken fragmented sleep, which increases the worsening of sleep patterns and the worsening of physiological sleep responses. So moving on, we're going to talk about the cardiovascular prognosis, which is really an important secondary consequence of poor sleep. This is where the PTSD and insomnia become an independent risk factor for cardiovascular disease, considering the fact that the mechanism includes a chronic sympathetic overdrive, which causes a lot of endothelial dysfunction. Now, in medicine, what happens is in cardiovascular disorders, endothelial dysfunction can promote the risk of plaque formation, can promote the risk of thrombus formation, which can increase the risk of cardiovascular disease, hypertension, ultimately leading to atherosclerotic disorders. The hypothalamic pituitary axis dysregulations also causes low-grade inflammations, which can cause elevated IL-6s and CRP inflammation elevations. What causes the heart rate variability and the reduced baroreceptor sensitivities and problems with sleep fragmentation, impairing vascular repair. A lot of the data that we've seen is important. The fact that veterans with PTSD and insomnia show higher major adverse cardiovascular events, which include increase in hazard ratios and cause problems with ultimately the cardiovascular disorders and diseases that are secondarily and indicated with poor sleep. So basically, what we're going to talk about now is we're going to talk about the fear extinction failure. Basically, what we need to talk about is REM, rapid eye movement sleep, is known as being restorative. It's the only time that the brain is free of noradrenaline, which is counterintuitive in terms of restorative sleep, because noradrenaline is an excitatory hormone which causes the brain to kind of prevent it from being relaxed and improve itself at night and cause and improve and provide the states of good restorative sleep. Basically, what happens is that when you have the PTSD state, you have persistent fear conditioning, and you have the failure of the body to update contextual safety signals. Basically, what happens is that your brain needs to be in a safe state within REM sleep to file away the danger effects of what you've experienced in the day, especially with refugee and newcomer populations who have been experiencing trauma and other types of traumatic events that they routinely experience, given the fact that they've been having experiencing traumatic effects at home, before their journey, or even after reaching their new states. The chronic sleep, what's known as a cognitive collapse, executive function and development, you get what's known as a chronic sleep disruption, and trauma produces cognitive collapse, otherwise known as a synergistic failure of executive function, memory reconsolidation, and waste clearance. Something that happens is what's known as the impaired lymphatic system, the inability for the brain to kind of prune itself or to deal away with the negative consequences of the day and improve the ability for the brain to be in a restful state, to do away with the brain fog and the attentional deficits and the emotional ability that mimics ADHD, depression, or early neurodegeneration, often refractory to stimulants until its sleep architecture improves. Sleep is not optional for cognitive recovery, it is the infrastructure. Let's just talk about the gender and generational perspectives. With regards to the generation and the gender-specific perspectives, women tend to report more subjective insomnia, nightmares, and disruptive nocturnal behaviors post-trauma. With regards to the biological, the hormonal modulation of the HPA axis, the stronger inflammatory responses, and REM rebound differences. Men tend to have more objective fragmentation in some studies, but women often have higher subjective burden and internalizing comorbidities. With regards to the intergenerational effects, the early life adversity produces lifelong changes, reduced sleep spindles, and later non-REM fragmentation, the epigenetic alterations in stress and sleep genes. Parental PTSD transmits via modeling, altered caregiving, and possible germline epigenetic effects, higher vulnerability of sleep disturbances, and emotional dysregulation in offspring. Basically, the tailoring of the interventions, the hormonal considerations in women, family inclusive approaches for intergenerational patterns. Moving on, let's talk about the trauma-informed clinical interventions. Standard CBT interventional requires trauma-sensitive modifications. Safety first. Remember, we always look at the bed as a safe cue, and the grounding objects, weighted blankets, face sleep restrictions, and pacing to avoid flooding during sleep restriction or nightmare exposure. Integrate with trauma processing, careful titration along with EMDR, and address fear of sleep explicitity. Framework is psychoeducational, stabilization, safety, targeted sleep skills, and trauma integration. Basically, we can talk about evidence-based interventions. So what we talk about here is optimized sleep hygiene with trauma. It works for all ages. Consistent sleep-wake schedules. Bed is for sleep only, and wind down buffer of the 60 to 90 minutes. Daytime habits, which includes the environment, making sure that your sleep environment is cold and dark and not so hot that it causes problems. Progressive muscle relaxation and deep breathing are highly effective relaxation techniques, and physical activity can also help in terms of improving your ability to fall asleep at night. And then journaling also, which causes nightmare, which can be secondary to nightmare dumping, which is improving ability for people to write and journal and to improve their ability to prevent the nightmares that are from occurring at night, from the secondary to their issues during the day. Using the life stage specific considerations, bedtime past visual schedules for children. Goal is stabilizing sleep in children, preventing the executive dysfunction, which is like a pseudo ADHD type of scenario. In adults, we can use the shift work optimizations and education on anchor sleep as well, and also social integration groups for preventing the glymphatic failure, which leads to accelerated neurocognitive decline and dementia post resettlement. What are other pharmacological interventions? We can use different medications which have been evidence-based. Prazosin, which has also been utilized for improving sleep in PTSD patients, which has been utilized in children and adolescents, and adults and veterans. It's mainly an alpha-1 antagonist. Melatonin has also been utilized as well too, and trazodone, which is utilized for immediate sleep, can be utilized as well. But it's typically the issue with trazodone is that it causes a what's known as a trazodone hangover, and you want to avoid that as much as possible by titrating up slowly and not overburdening the utilization of the trazodone. So basically, the key takeaways and conclusions: sleep is a foundation of resilience. It's not just being tired. The cardiovascular disorders and diseases can be secondarily due to poor sleep as well too. So we have to maintain that. We have to always maintain that consistently keeping sleep is important to improve cardiovascular disorders and to improve cardiovascular health. If we cannot, we can't ask a person to learn a language, find a new job if their brain is operating in a permanent state of exhaustion. If we can't fix the sleep, we can't really fix the person. What we're going to do now is we're going to have I'm going to open it up to questions. Anybody have any questions or concerns?
Okay, thank you, Dr. Z. We actually have someone who has a hand raised.
Thank you.
Uh, you're
So
welcome.
we talk about how many hours, and I'm really interested in knowing the time that my clients, for example, they go to bed, and how it affects the time more than the how many hours they sleep.
So you're saying that the time they go to sleep has more of a contributory effect to their health than the number of hours they sleep? Is that the question?
Well, yeah, I wondered how much it affects. Like, for example, is it the same to sleep 6 hours during nighttime that is sleep six
Ah,
hours starting, for example, at 3 in the morning?
okay. So basically, what happens is that it's more important about the of sleeping at night versus sleeping during the day. So what we see in the research is people who sleep on the day shift work night shifts. Okay, if they sleep at if they sleep during the day and work the night shifts, they tend to have increased risk of cardiovascular disease, metabolic disorders, brain fog, decreased comprehension. So we see that more in people who have work night shifts. Okay, so if your clients are still sleeping at night, that's really important. It's about making sure that they sleep at night versus sleeping during the day, where the data shows that people who sleep during the day and work night shifts have more metabolic and more cardiovascular, more physiological concerns versus versus sleeping at night. As long as they're sleeping at night in the dark, it's about, because remember, we're all circadian beings. So the light, the amount of light that comes into your eyes will determine whether or not your brain is going to determine whether or not it's time for it to go to sleep or not, and to shut down and to wind down and to impart the overnight housekeeping routines of the glymphatic changing, the pruning, the kind of consolidating of the neuronal structures at night versus during the day, where it's not supposed to, because during the day light is supposed to impart to the brain that we're supposed to be awake and active and actively contemplating new ideas and turning and taking in new information. So if they're sleeping at night, that's always a good thing versus sleeping during the day. Long story short.
Yeah, thank you.
Excellent. Thank you.
Thank you for the question.
We have another question in the chat. Can we say that poor sleep can be related to some type of health conditions?
Poor sleep, yes, can be related to many health conditions, or a lot of times what we see is that poor sleep can worsen or exacerbate or cause health conditions as well too. So what can happen is that poor sleep can cause worsening of cardiovascular disease. It can cause worsening of metabolic disorders. Obstructive sleep apnea can actually worsen diabetes. It can worsen blood sugar. It can worsen, and ultimately the long-term effects of increasing blood sugar, hyperglycemia, can lead to it can be caused by poor sleep at night. So one of the hallmark therapies of obstructive sleep apnea for diabetes is the CPAP machine, which has been shown to reduce overall hyperglycemia overnight, which can reduce the long-term effects of overall high blood sugar, which can improve overall health over long periods of time. So it's kind of like is it the chicken or the egg type of thing, where in terms of sleep, because sleep has such a it's so encompassing of all the factors of human life that it's not necessarily one to the other. It's think of it as being related to every single aspect of your life. It can cause worsening of conditions. It can improve conditions. So what I would recommend is that you improve your sleep, and other metabolic and other medical conditions will improve. Somebody has written in the chat. I read somewhere that long-term use of melatonin causes heart issues. Is that true? So there has been some documentation that has been shown about that. There's been some documentation that has been shown that melatonin can cause blood issues as well too, lymphatic issues as well too. But so there's research studies happening all the time about melatonin. So there's new data coming out. What I would recommend is that for melatonin usage, contact your physician, your primary care, and see what they think about that. But I would recommend that you use melatonin with caution and not to overburden yourself with using too much melatonin. But then again, we're not here for medical advice. We are here to provide sleep strategies as well too. Let's see, what else do we have here in the chat? Let's see, any research or information specifically related to sleep for refugees or newcomers? Any research or information specifically related to sleep for refugees and newcomers? Yes. The fact is that unfortunately, refugees, newcomers, they tend to experience poor sleep just as a general rule, because of the fact that they're never able to get those full 8 hours of sleep at night to experience the kind of restorative REM sleep and stage 3, stage 4, slow wave onset sleep spindles that we all tend to take for granted, unfortunately. And so therefore, with the fact that they don't experience the restorative sleep, they tend to have the long-term poor effects of poor sleep, which can cause or worsen other conditions. The main thing is that utilizing sleep hygiene, utilizing sleep health should be a primary modality for people who are refugees, newcomers, migrants, who tend to experience fragmented sleep patterns. Basically, PTSD is seen a lot in these populations. So therefore, emphasizing improved sleep with either sleep hygiene, sleep therapy, medications is always a good strategy. How would you navigate sleep with consideration of disorders where fatigue, insomnia can be symptoms, PCOS, polycystic ovarian syndrome? How would you navigate sleep with considerations of disorders where fatigue, insomnia can be symptoms? Oh, so polycystic ovarian syndrome, the same strategies would apply in terms of improving sleep hygiene, sleep environment. PCOS, it tends to be due to other metabolic concerns that are also important that need to be addressed by the primary care physicians or specific providers who work in those specific realms. All these need to be managed by proper medical providers. Can cognitive behavioral therapy be an option treatment? Yes, of course it can be. CBT is a treatment modality that has shown good documented evidence for improving sleep and sleep PTSD at night. Yes, it can be.
Do you think some natural teas could help to sleep well?
Natural teas, yes, obviously, chamomile tea at night can help with sleeping with sleep. Anything without caffeine, I think Earl Grey is one of those ones that you don't want to have because Earl Grey has a lot of has a lot of caffeine in it. Chamomile tea, I think, is one of those recommended for helping with inducing sleep at night. Also, a cup of warm milk as well too, with the tryptophan in there to help induce sleep at night too as well too. Is there a sleep assessment available? There are sleep assessment scales available. We can provide that for you in a CTA response if you'd like. There are scales available that providers do utilize. Can you share some ideas for tackling sleep issues for children? Exercise, wind down time, scheduling. Your information about sleeping seems very relevant for clients. Well, yes. For children specifically, physical activity, physical exercise is one of those highly recommended for children because it can naturally wind them down. Usually utilizing a 60 to 90 minute buffer time before bedtime, specifically with preventing utilization of electronics because of the blue light. What happens is that the blue light from phones, devices, screens tend to reduce the ability for the brain to naturally wind down. So that intends to increase the kind of like say the hyperactivity in children. So reducing electronic usage within 2 to 3 hours of bedtime. I know a lot of families, particularly with that when it gets to be close to bedtime, the phones get turned off and get put away into a box, into a box outside the room, so that it doesn't impede the person's ability to fall asleep at night. That's a strategy to utilize. Scheduling is important because keeping kids on a good schedule is an important strategy to improve their ability to fall asleep with their regular hours and regular intervals, to induce a normal circadian rhythm, and to promote good sleep hygiene and good sleep responses as well too. So yeah, there's a lot of good questions in the discussion today. Eating right, exercising, diet can also hugely. There's been a lot of data, a lot of showing that the ultra processed diets of the Western cultures, ultra processed food, nuts, not whole foods, can also cause a lot of dietary metabolic issues that increase poor sleep hygiene, poor sleep issues at night. So making sure that the whole foods are utilized and not the ultra processed diets as well too that are common in the Western societies is an important strategy in improving sleep and sleep hygiene and sleep effectivity at night too as well.
Those are really great questions. If anyone else has any, as Dr. Z noted, feel free to raise your hand or unmute to ask a question or drop it in the chat. You all are asking some really, really great questions. I do have one question for you as well, Dr. Z. When you spoke of interventions, which would you say are probably one of the most realistic ones, or maybe most accessible ones for newcomer families who might be dealing with overcrowded housing, financial stress, or just like ongoing uncertainty. You kind of talked a little bit about all these other factors that could impact their sleep. And I know for a lot of families, they're sleeping and maybe or living in the not the best conditions.
Yeah, right,
So what
right.
could be some realistic or accessible strategies for those families?
So basically, I mean, as long as you can maximize your sleep environment as much as possible, trying to make the environment, it all depends on what you have available to you, of course. Improving the environment as much as possible, trying to keep the room as cool and as dark as possible. White noise machines as well too. White noise machines, keeping maybe a fan or some kind of device that'll help to induce sleep. All these different interventions can be utilized to improve the sleep as much as possible in terms of a difficult situation. If you're able to maximize the situation and maximize the environment as much as possible, I think you can maximize your quality of sleep as well.
Excellent. Great points. Thank you so much, Dr. Z. If you all have any additional questions, we welcome them. As noted, please take a second to scan the QR code on your screen. This one is specific to today's presentation. So this survey just kind of allows you all to offer us some feedback on the presentation that you just heard today. Let us know if you have any ideas or thoughts for additional topics that you would like for us to present on. And yes, we would really appreciate hearing more from you. It looks like we have another question that says, would love to hear more on executive functioning and how it can be applied by service providers working with clients on sleep hygiene.
Executive functioning in terms of how it can be applied by service providers working with clients on sleep hygiene. So sleep hygiene is, you improve your environment, you stop using the electronics before bed, you only use the bed for sleep, you don't use the bed to lay down and watch TV, you don't use the bed to read in, you don't use the bed you don't go scrolling in your phone and sleep in your bed. If you're in the middle of the night and you wake up and you have fragmented sleep and you're just kind of awake, you get up in the middle of the night, you get out of your bed, so you don't associate your bed with laying down, with keeping your eyes open and just being wide awake at night. You get up, maybe sit at your desk, sit at your chair, sit on the floor, basically get out of bed. Do something that's kind of taxing, mentally taxing. Do some reading. Do something that you find maybe a little boring. Don't watch TV. Don't do something that's mentally stimulating, and your brain is actually wanting to shut down naturally, and you need to help to induce it to do that. Calms itself down. Basically, that's the kind of the recommendations to improve the sleep hygiene, to utilize sleep hygiene. We want to avoid fragmentation. We want to increase the consistent number of hours of sleep that we achieve and improve the quality of sleep. More about the mental skills that need to be worked on to help with planning, focus on sleep, and managing emotions behind the lack of sleep may be. The planning, making sure that you find your space to sleep at night. You plan ahead for that sleeping session at night. You make sure that the area that you're going to sleep in is just going to be utilized for sleep and nothing else. It's not going to be utilized for homework. It's not going to be utilized for reading. It's not going to be utilized for studying. It's not going to be utilized for watching TV or entertainment and anything like that. And also making sure that your focus is just going to be on sleep at night. And then you want to kind of, put yourself in the mindset that I'm going to sleep at night at this many hours, and hopefully you won't have anything to worry about at night, and that you'll be able to actually get good sleep in, and then kind of calm yourself down and improve your sleep, and therefore you can tackle the issues for the next day.
Wonderful. I'm seeing lots of clapping hands for your presentation, Dr. Z. So thank you. Thank you all for dropping your emails in the chat. You may not have any questions that came to mind right now during the presentation, but we want you all to know that you are welcome to reach out to us at any time with any additional questions that you have. One of the easiest ways to do so is just to submit a CTA request, which is a consultation and technical assistance request. And how you can do that is if you go to our website, you'll see right at the top right corner, there's a little button that says request consultation or technical assistance. If you just click that, what you'll shows up on the slide will pop up. Just a little form that you need to just quickly fill out. Let us know what your question is or how we can support, and we will get back to you within 1 to 3 business days. And if any of you enjoyed this webinar, I know we all did. If you would like more specific coaching or training on the topic of sleep and how to support refugee and newcomer communities, we can offer what we call coaching sessions where we can provide something that's much more tailored to your team. So feel free to reach out for us too if you would like that. Another way that you can contact us. So of course, thank you all for being here for today's webinar. Thank you all for your participation and interaction. Let us know your thoughts, your feedback. We would appreciate it. But I'm seeing lots of comments in the chat, Dr. Z, saying thank you so much for your presentation. There's one that says, thank you, Dr. Ali, very informative and eye-opening. I work at a shelter and a lot of our residents have disrupted sleep patterns. So this is useful to take back and share with clients. Wonderful. This is awesome. Thank you all for your feedback, thoughts, or ideas on how we can support you and your teams in the work that you do.